Ladies and gentlemen, we are in the Stawisha National Stakeholder Workshop on strengthening the role of pharmacists in sexual and reproductive health and rights as SRHR service delivery in Kenya.
Why we felt this was important was you are skilled, you have food, you will get sick. So if you are able to engage you in the space of health and you are able to, we are able to reduce teenage pregnancy because that was the biggest issue that was troubling us as a county. We did a survey in 2 sub-locations in Siaya County and we got 2,000 girls under the ages of 24 who were either pregnant or with a child. And these 2,000 girls, the youngest of them all was 11 years old. Jihusishe nasi because we would want you to be involved, and that is why we are here today with Pharmacists. We've worked with CHPs, we've worked with CEOs, we've engaged so many people. But for the longest, the pharmacists who are the first point of contact for a lot of these young people in terms of accessing sexual reproductive health and rights products and services were left out. So we felt the need to be able to incorporate you and start this very important conversation.
We know there is the burden of public health facilities whereby client and COVID client. My take on advancing policy, advocacy and legal protection is that we need more better defined scope of practice for pharmacists and better legal protection and provision in terms of touchy areas such as consent when it comes to age, because we do have the willpower and the ability to provide these services and products to our citizens of Kenya.
We already have existing registered pharmacies led by pharmaceutical technologists and also registered pharmacies. So what we basically need to do is ensure that there is what we call continuous professional development among the various cadres, that is the pharmaceutical technologists and the pharmacist. How can we do that? This we can easily achieve by ensuring that anytime they take a course, these courses are continuous professional development accredited. And if we do that across the healthcare sector, then we are going to improve standard of care throughout.
My take on accessibility to RH services, there are a plethora of them. One that is included is during maybe a woman has given birth, where they can access in a public hospital the same services, what we normally call postpartum family planning services. We qualify for all of them in a public facility, and the same can be claimed by the same facility under the insurance that the person is using, especially in Kenya, where we are using what we call the primary health financing under social health authority.
Unfortunately, there is a very wide gap that exists in terms of SRHR policy relationship in the space of pharmacies. And this is unfortunate because if these pharmacies provide a very private, secluded and easy to go to space for the young people, and we do not have a way to, 1, protect the young people, 2, protect the pharmacies themselves, then this calls for an urgent action, and the action is to be able to relook at the existing gaps. And these are the gaps that whenever we are able to properly address them, then we can be able to improve access to SRHR information and services within our pharmacies at community level and even at government levels.